Gracias. Thank you everyone for joining. I'm very happy to be here again and to share with you some of the insights I've had in working in this trauma-informed space. And hopefully you'll find some of this information useful. And I'd love to have a discussion at the end about what you have found useful and other things that you might still find are challenging so that we can continue to learn from each other and grow and in this very important area. So I can start sharing my slides now. Flora, I will do my best to speak slowly. I'm not very good at that, but I will. I'm working on it. Okay, just 1 second. I'm showing my screen. Can you all see that? Can you all see my slides? Excellent. Okay, as I mentioned, I'm very happy to be here. So a lot of my work, so I mentioned RTI International. I've been there for about 18 years. I'm a senior research psychologist. A lot of my work has been focused on trauma-informed care and developing different approaches in a range of settings. So I've worked in a lot of community-based settings, in school settings, but also hospital settings. Most recently, and so really trying to find ways to bring some of these inputs to better help serve not only ourselves, but also the patients we serve, but then also our colleagues and our staff. So under this broad umbrella of trauma-informed lens, I do a lot of work in telehealth for trauma-exposed victims of crime living in rural areas. I also have done a lot of work developing assessments and intervention approaches for individuals who experience trauma and related consequences, so like anxiety, depression, or other forms of mental health challenges. And a lot of my work has been with immigrant youth and families and adults. So I try to weave in as much as possible and when relevant, culturally responsive and congruent adaptations of interventions to ensure that these approaches and recommendations are scientifically sound and really in line with the needs and the perspectives of those we serve and those doing the serving. And so that's why I really love this forum, this opportunity to discuss with all of you your reactions, even your thoughts about some of the things that are common practices in the literature, because your perspectives also help us refine and improve these approaches. That's going to be a big theme you're going to hear about today, the importance of when we're doing trauma-informed training and trauma-responsive approaches, it is so important for us to continue constantly learning and growing in this area. It's ever evolving, and we need to continue to refine our approaches. So for Nuestro Tiempo Juntos, here's my agenda. And so I really want to, again, focus on defining trauma and what it looks like, what a trauma responsive approach is. How is that different from trauma informed care? It's very similar, but it's important. The distinction is a little bit different and very relevant to what I'd like to talk about today. So how to identify it, what to do when you see it, and then my focus is going to shift to providers. I want to give some providers some resources, and I want to have an emphasis a little bit, if we have time, on de-escalation approaches. And the reason I think that's so important is, again, it goes back to training. The more aware we are of these approaches, the easier it is for us to implement them automatically. And it becomes easier for us to weave it into our everyday experiences. So even when we're working with our own staff, our teams, that we can weave these in and model this type of behavior. It's trauma responsive approaches are really, really learned. And the only way to really get a good handle of them and know how to respond when they're occurring is to practice and to do these trainings. So I really like talking about this a lot, and myself constantly trying to get more training. At the end, I mentioned, let's talk a little bit about what your experiences are in your work and what you find useful and what isn't useful in some of the things I said that you would like to hear more about. Okay, so when thinking about defining trauma, it's important for us to understand what it is and what it looks like. So it could be either a single acute event or a cluster of events or a series of chronic stressors that accumulate over time. And these events overwhelm an individual's ability to cope at the moment, and they threaten their sensations of and feelings of safety and survival. And some trauma experts talk about trauma as this injury or a stress injury. And when the stress is acute enough, it can cause us to fear for our safety. And if the stress is chronic, it leaves us limited room for recovery. And so often I like to think about ways that we can weave in strength-based approaches to try to ignite and bring in stronger and different ways of dealing with traumatic stress. We know that when they're very severe, this level of toxic stress can lead to physiological changes in the brain and the body. And again, they range from mild to severe. And these reactions have a lot to do with where that person is at the time and their coping capacity and what kind of support system they might have. Here's the official definition from SAMHSA. It's the one that's often used, at least in my work. Again, an event, a series of events or series of circumstances that are physically and emotionally harmful or threatening. I like to emphasize this because oftentimes, you know, the more there's mental health literacy we have, the more we might misuse or throw around words. And so it's important to really think about the focus of it being different from an acute stressor. I want to talk a lot about that so we can distinguish that better, but really understanding that this is something, you know, that it's really threatening the individual, their safety and their security. And so some key factors for trauma-informed and trauma-responsive care really have to do with really understanding what this looks like. So I really want to emphasize this a lot. And then when you might do other trainings, you might hear people always going back to the definition and always going back to seeing what it looks like, because it's important for us, unless we're constantly working in this area, working with a lot of individuals exposed to trauma, it might be more difficult to recognize it. And so that's a very, very important first factor. And that's the trauma-informed piece. But to be responsive is then when you're able to shift and actually behave in a way where your reactions to these events, when you're with individuals that have been exposed, are focused on, you know, compassion, helping them promote safety in to the extent that you can, earning and maintaining trust, and understanding and embracing diversity. And within diversity, I mean here also not ethnic and culture, but also reactions and what kind of ways these traumatic reactions can be expressed. And all of this is so important for helping us foster dignity and respect, and really can make important strides in helping individuals trust us and really start shifting their trajectories from a very negative trauma reactions to more positive and resilient ones. And ultimately, that's the goal. The goal is to be informed and responsive, and that involves, I'm going to keep saying it, but I think it's so important not only for ourselves to look for information for continuous training, but then to seek it out as well in your own organizations. Engaging all patients from a trauma-sensitive stance to reduce the likelihood of re-traumatization, understanding how to create a space to be able to have these conversations about traumatic stress, and recognizing risk factors and the symptoms that, and the impacts that these symptoms might have, and finding ways to respond to an active traumatic stress reaction. All of this is very important. It really, really helps us get that shift from the negative reactions to really switching to more positive. And so it helps us think about, you know, that shift from what is wrong with this person? You know, what is going on with them, to just like, what might this person be experiencing? Where is this coming from? And what have they experienced or survived that is really playing a big role in how they're behaving. And so that really helps us with our own self-regulation and then co-regulation of those around us. That's very important. And again, I can't emphasize this enough. It's so hard to do unless some people have a natural inclination towards this, and that's just how they are. And then, and luckily for us, in terms of our field, we benefit from that. But I think it's also very important to understand that all of these are learned behaviors and practice. And so the more we're aware of them, the more they don't catch us off guard, and we can then be able to respond in a better way. Okay, so here's some of the impacts of trauma. So I mentioned before, they can go anywhere from minimal, moderate to severe. This is kind of like what it looks like. I think of many of these different types of traumas and these different levels. I notice I haven't yet used the word PTSD or post-traumatic stress disorder. And that's because many post-traumatic, traumatic reactions never become PTSD. They never even get there. Most individuals actually are very resilient and respond well. And so I find it more useful to start reshifting our focus to a more strength-based to help us ignite and encourage resilience, to understand what the traumatic reaction or impact can look like and how my approach can actually help them start shifting to a more strength and more resilient perspective. And that part is really important to really ensure that we have and encourage minimal outcomes. And again, I keep saying igniting resilience because there are ways that we can do this. Let's see what else. So in terms of the different signs of trauma, most of them, you can divide them into the emotional and psychological symptoms, but there's also physiological symptoms. The emotional and the psychological that you might see or the person might already come to you with involves individuals exhibiting symptoms such as intense fear, anxiety, and sadness. Those are the ones that we tend to be most familiar with. Oftentimes, whether it's in our own experience or what we have learned from, those are the ones that we hear about the most. However, trauma so often is expressed in anger and irritability and in mood swings. And you might also find that individuals are experiencing intrusive thoughts, nightmares, flashbacks related to the event or the series of events, and or just this overall feeling of not being safe and not feeling secure. And then you also might find that there are a lot of more psychological symptoms related to challenges in concentrating, memory problems, or exhibit signs of dissociation. Individuals that have experienced trauma also have a lot of physical symptoms. Unfortunately, trauma can really manifest themselves physiologically, and they experience a series of different types of problems, so often linked to chronic illnesses, so chronic pain, headaches, gastrointestinal problems, or other unexplained physical ailments are very, unfortunately, very common in individuals who've experienced chronic trauma, especially if it's been, so I mentioned before, it's either acute or like a cluster of events with chronic traumatic events. You often see this when individuals have these more complex traumas. And it can really impact long-term their immune system, leading to frequent illnesses or recovering from illnesses. And another big one is these changes in behavior. Trauma can significantly impact how a person behaves, and this one day to the next, and something in a way that's usually not them. And so you might find that patients may exhibit avoidance behaviors or avoiding specific places, people, or activities that remind them of the traumatic event. And they also might withdraw socially or isolate themselves or have difficulties in interpersonal relationships. And again, oftentimes we might not view these as a traumatic reaction. Unfortunately, especially if we are overworked and we have limited resources in our own day-to-day, so often these can be framed as the person is just being difficult, the person is just not flexible. And indeed, those are, in case that there's face validity to what you're saying and seeing, but oftentimes it's very important to help us understand where they're coming from and why this is happening so that we can then reframe our approach to be able to help them. Some of the big obvious ones, especially for the more severe forms of trauma, are hyperarousal and hypervigilance. And these have to do with individuals who experience this heightened state of arousal, and they might be, for example, easily startled or have trouble sleeping or have exaggerated responses to things. They might constantly be on guard or scanning their environment for potential threats. And understanding when they, sometimes this could be subtle, they could experience it and feel it. Like when I talk to patients and I ask them about hyperarousal, hypervigilance, they are very clear that this is something that they experience a lot, but you might not see it as much. But if you're able to catch some of this, it really helps in how you then respond in terms of helping them not amplify this. Again, see here some additional impacts of trauma. I have these, so I want to share the slides afterwards so that you can have these on hand. But again, the physiological loss of sense of control, loss of sense of self. There's also a lot of confusion or shame and guilt for what might have occurred to them, and maybe their impact on it or influence on it, or why it happened to others and not to them. There might be disruptions of them in sleep and eating, and self-regulation is very, very difficult in severe reactions. And so again, that comes with heightened emotions and several different types of challenges with certain triggers or experiences with flashbacks. In general, relationships feel very insecure. People talk about these internal sensations that are unmanageable and unbearable when that didn't happen before. They didn't feel that before. And so when thinking about, I know a lot of our audience today work with Latinos, so I think it's important to think about why or some specific reactions that our Latino neighbors and our clients and patients might experience. And this is not unique to Latinos, is more related to more general experiences that many Latinos have. And so you're talking here about migration factors, acculturation, historical and intergenerational trauma. Many of these things we're familiar with, we understand, we know, we've seen people experience this. But for example, an undocumented immigrant may experience heightened fears real fears of deportation or family separation, which add this additional layer of the trauma that they might have experienced in their country, or even in the migration process. And then this is really amplified. And so recognizing and addressing these intersecting traumas is important when trying to provide a comprehensive and culturally sensitive care that we're trying to do here collectively to our Latino community and beyond. And so whenever, when I mentioned before about the fight, flight, or freeze, sometimes this might mean flight, which an avoidance, which they might never show up. And so oftentimes you might refer a client, or you might refer a coworker somewhere, and they might not go. And there's avoidance behaviors or freeze behaviors where they don't want to talk about it, or they don't want to engage in certain things, and that is related to the trauma. So even being aware of this can help us find alternative ways of even being able to talk to them directly about it, or finding solutions that might be better for them where they are at that moment. And again, we often might not see people because of the flight or the avoidance. And again, understanding these factors can help us craft better alternatives to get them the services that they need, and understand why they might not be showing up for treatment. Okay. Here I want to talk a little bit about the signs again, and one big question that I always get that I later want to hear from you all about are differentiating normal from traumatic stress. And so stress is, we know it's our body's response to pressure, and oftentimes we do experience stress so much in our lives. And so oftentimes people have challenges like really differentiating with, okay, is this a normal reaction to everyday stressors, or is this already getting into something more chronic, or even into something that is related to this accumulation of more severe stressors, or even where there have been very difficult situations where there's trauma involved. And so you do see some here some of the physiological responses that we often get from regular stress. Sometimes it's positive, and stress can help us also feel a range of negative emotions that are appropriate for the situation, and they should be expressed. I think it's important that we let people feel what they are feeling instead of bottling it up. And so being able to have more language related to, yes, you're feeling excited or worried or angry or frustrated because of stress is very important. However, stress can also have more, not positive, but just more responsive and resilient factors as well that we don't see in traumatic stress. And I wanted to include those here. I think it's important because it helps us. The more we understand positive reactions to stress, the more we can help others identify them when they are in a very a more negative state after traumatic reactions and having. So I think these are important to really think about and really look for and find ways that we can help others. Oftentimes, if we do this in our everyday work, in our teams, or even with our clients, even if we're not providing therapy for them, this can really help a person that has gone through a lot supplement what they might be already working on in therapy, or just even make their experience a lot more positive. So again, being able, when you're under heightened levels of stress, like good stress, you're able to think more clearly. You have options. You can consider options. You can act rapidly. You feel comfortable about facing a problem head on, taking on challenges. Your memories are more clear about what happened. You have you're thinking more clearly, and you can remember things. And you have an orientation towards creating solutions and feeling in control. And these are all very, again, very positive ways, very strength-based ways that we can help individuals try to navigate towards. Traumatic stress is very, very different. We, here you have this prolonged fight, flight, or freeze, where you have individuals that are just not able to respond to a situation, they're avoiding it, or they're just very aggressive in a situation where they are exposed to stressors. People talk about feeling smothered, like their muscles are so, they feel like they're exploding because they're so tense for such a long period of time. They feel terrified or panicked, or they're mentally shut down, engaging in avoidance behaviors. Or you have the opposite side, where they're feeling enraged, angry, cynical, and helpless, and feeling worthless. And so when you have these set of trauma stress reactions, your more positive options for coping and for dealing with challenges are just really hindered. And so trying to find ways to help them try to remember that they have found options in the past, that they've been able to face difficult things in the past. Those are the types of things that a trauma responsive approach can help an individual get through difficult challenges, even when they're not in therapy. There are some other considerations that I wanted to chat about a little bit about related to working with Latinos. And this is, I just wanted to touch on different ways that certain experiences can amplify a traumatic response. So added stress, definitely, but also limited language can really amplify negative reactions, whether in person or even in avoidance altogether. So we find that there are a lot of people who say, I'm not going to go to the emergency room because there's not going to be a person who really understands me. I just rather just avoid it. I don't want to really relive all this again when they can't even understand what I'm saying. So I have to repeat it over and over, and I don't feel comfortable, and I don't even know if I should trust them. And so for all these different reasons, it encourages the avoidant behaviors. And so, and we've discussed this here the last time I was here, and I noticed in several other of your discussions, talking about ways that we can increase language accessibility, which is a really important consideration, so we can kind of like mitigate some of these negative responses. Building trust is also very important. This is a very important way of building trust. And then I think I don't want to run out of time. So I have several other things, but even finding ways to bring in cultural activities into a lot of the things that you do. I work with a lot with El Futuro, and one thing I think they do very, very well is really bring in a lot of very positive cultural activities into things that have nothing to do with a lot of the work that they're doing related to mental health. So often I've heard in patient interviews that you go to El Futuro and the stigma is reduced because there's just, people think of it as a place where there are just a lot of things that are related to Latino culture and positive aspects of it. And they often forget that this is a mental health services. And so that type of thing might not always be feasible, but it really does go a long way in being trauma responsive. Let me go to the next one. Okay, so I get a lot of questions about why trauma-informed care is so hard to implement. And I'd love to hear your perspectives on this. And I have here some important reasons why it's difficult to implement. And it really is. So often it is. And so I keep saying that it's important for us to get continuous training in trauma responsive care, specific to the work that you do, because there's a lot now, there's more and more information and trainings available to really allow you to weave in trauma responsive approaches to your everyday work. And that's very important because the more we do it, the easier it is to implement. But the main reasons are limited awareness. We know oftentimes either ourselves, but those that work with us might not have sufficient knowledge and training about trauma and its effect. And without a solid understanding of trauma, it's very, very hard to implement trauma responsive care well. We also have very real time constraints and limited resources. So often we're so very busy, and individuals working in a range of different healthcare settings or public health settings often operate under-resourced, limited time constraints, making it really challenged to allocate sufficient time for a comprehensive trauma assessment and individualized approach that we often hear about in these trauma trainings. Oh, this is how you should do it, and you should implement this and this and this. And so often, I hear from providers and I hear from, different champions in the field saying, we don't have time for that. There's just no way to do that well. So I think the more we find ways to make this more feasible and break down the institutional barriers and organizational culture that might limit what we can, how to really weave this in, can go a long way. Stigma and misconceptions are a big one as well. If you are working in a setting where there's still a lot of stigma around, again, the negative traumatic reactions, because I think generally as a society, we've been a lot more open to the flight and the freeze responses to trauma. We still have a lot of growing and just to do in terms of the negative reactions, because those are very, very difficult. Very, very difficult when someone is disrespecting you and actually in your space, having a clear traumatic reaction at that moment. That's not, that the fact that they've experienced trauma is usually, it's harder to be aware of that and really implement some of these trauma responsive approaches. And so finding ways to have professional and personal boundaries is going to be really, really important. It's going to help you navigate sensitive and potentially triggering topics, because it's going to be emotionally demanding for you all to really engage with these more aggressive traumatic experiences, and maintaining that boundary and self-care is very, very important. Let's see, what else? And so despite all these challenges, we're making efforts in trauma-informed care through education, training, policy changes, all of these different things for raising awareness and providing resources. But I think it's important that we're in positions to foster the supportive environment so that we can do this well. But unfortunately, that then brings in extra stress for providers and those implementing this type of work. And so I want to talk a little bit about that and spend some time on this, because I feel like this is an area that I've been working a lot in the past 3 years. I've shifted a lot of my focus to the experiences of providers. Unfortunately, I've been, seeing that so many of the providers, and whether it's in public health settings or medical settings, emergency room settings, so many have experienced, and it's obvious, secondary trauma or compassion fatigue, a lot of burnout. I see a lot of burnout. And this is not only in ourselves, but then also our team, including administrative staff, other clinical staff, our security staff. All of them have been through, so much in the past few years, and it just accumulates. And it's just like once the more, not only things going on in our areas, but things going on in the world. And so there are reports, and these are just underestimates, like over 40, almost 40% of providers are reporting feeling vicarious stress and trauma. And these are individuals that are not even working in regular traumatic settings. And by what I mean by that are just people that aren't necessarily working with trauma patients or clients on a regular basis. And so one of the challenges, one of the reasons why burnout is so real is because it's really hard to tell. So many of us are already very, very resilient. And so you might not necessarily know how to best know when you are entering a state of burnout. And so here are some of the signs that I think are really, really important for us to be really aware about for ourselves. So increased irritability, that's usually not you, like when you're wondering, why am I feeling so irritable? Or this inability to concentrate, feeling angry or cynical, or having unusual sleep patterns for you, or feeling guilt or hopelessness, avoiding things that remind you of difficult experiences. Again, these are things that are not typical of you. Chronic exhaustion, physical ailments. I mean, the more I read them, the more I think to myself, oh my goodness, I have all this all the time. But unfortunately, I'm surrounded by people who feel this often. But unfortunately, that is a reality of where we are right now. And a big part of it is because so many of us haven't really fully recovered from what COVID-19, the impact of COVID-19, and so many providers have not. We see this increase in the chronic stressors, exposure to death, illness, and chronic adversity. And for many of us, very limited control in so many situations and feelings of chaos. And so this amplifies, going back to the different stressors that are, or signs that you might be entering a state of burnout, or you might be fully in a state of burnout. It's important to consider and to be on the lookout for. I wanted to take a break real quick just to see if there are any questions as I move on, because I really wanted to then move a little bit to trauma responsive approaches and then de-escalation. But if there are any questions. Okay, I can keep going then. So in terms of being trauma responsive while taking care of you, this is something I'd love your feedback on and just insights as well. I think it's important that as we think about when we're continuously engaging in trauma responsive approaches, which mean, really being able to, when you're faced with an individual, and I like to continue to go to the aggressive response, because those are the ones that we tend to see that are more challenging. It's important to remember to regulate yourself and to be present with positive energy, try to listen actively, and have an open dialogue about stress and trauma. And then also develop a capacity to respond firmly and clearly and consistently. I mentioned before about the boundaries. This is a big part of the boundaries, and helping them separate the past from the present. Again, helping them remember that they can exercise control and choice, even though they might feel like they're not in control anymore, that they still can be in control to a certain extent. And really being able to show and emphasize that there are rules and expectations that you have. And so, and all of that, doing this with compassion can really go a long way. And it's the essence of a trauma responsive approach when you're not a therapist. So a lot of this, I didn't mention this before, a lot of these that I'm talking about are things that individuals can do, not in a therapy setting, in any setting. So all of these things help ground the individual, help them separate the past from the present, helping them whenever possible recognize this connection that the past happened before, and that right now they are in a safe place. Sometimes we have to use that language, and it's important. And sometimes, you have to be kind of careful because you don't want to be patronizing or condescending, but just even giving the message of you are in a safe place can really go a long way. So again, important to do as far as showing compassion, but also it's an important way of taking care of you. I find it useful to practice this a lot. I weave it into my intentions for meetings, for example, with my staff. So that's one thing I have found very useful that I encourage and invite you to see if that works for you. For a lot of these trauma responsive trainings, think about how you can weave this into your everyday work, how you can add the learnings to your to-do list, to the intentions you have with your meetings, to the interactions you have with others. It's a very important way to practice self-regulation and co-regulation. And then I find, and because of this, I have found this very useful to also talk a lot about de-escalation techniques, even if you're never in a position to need to de-escalate. It's so great to learn a lot about de-escalation techniques because they help you build this repertoire of behaviors, especially when you're caught off guard, to really know how to deal when someone is triggered or have experiencing triggers of trauma, or experiencing possible signs of danger based on their own experiences, and they have a reaction that could lead to this sense of I'm not in a safe place anymore. So within a trauma informed approach, escalation really helps us get at all of this. Just a second, my screen froze. Do you still see my screen? You also see my screen? Okay. Again, it's very important that the more we're familiar with this, it's so much easier to convey messages of compassion, empathy, and care. And that's very hard when a person is very aggressive. And oftentimes these traumatic reactions that are more of the aggressive type tend to be very disrespectful in many ways. So it's very easy to conflate the two and move away from this person is exhibiting a traumatic reaction. And there are things that I can say that I could help them de-escalate this quickly. So de-escalation is essentially a process that helps manage conflict. And the different types of traumatic reactions I'm talking about here are verbal agitation, aggression, or violence between individuals that you might see. And again, it builds. So thinking about how escalation escalates, you might see it starting with general irritability, and then more focused direct irritability, or broader indirect irritability, and then just direct action that's just full on aggression. And here are other ways from a trauma informed approach that can help us, think about how to reframe, especially at the different stages of where a person might be. And again, all of this might happen between mild anger and rage. And oftentimes, the earlier we're able to intervene and see this, the easier it is for us to de-escalate. Always remembering to convey messages of compassion, empathy, and care in authentic ways. It's very easy, oftentimes, if we don't have a lot of experience, to sound patronizing or to inadvertently, or to sound like we feel sorry for them, and that's not what we want to do. So again, the more we think about this and frame this and get training in this, the easier it is for us to do this, especially if we're not used to working in these settings. I love this quote, and I had to share it. So I'm again, when I share these slides, you'll have links to all of the resources that I'm bringing in. But here, de-escalation requires empathy, compassion, kindness, and partnering and understanding with sincere willingness to help. Trying to understand when the patient in front of you is agitated and treat them like you would want to be treated if you were in their shoes. And that last statement is really, really important. I feel like that is so important for me. And often I don't necessarily think about how I would like to be treated, but I often think about how I would want a loved one of mine to be treated. And it really helps you shift the focus quickly. And again, oftentimes in settings like this, it's so easy to say, oh, that's obvious. Of course, I'm going to do that. But it's very different when it catches you off guard and a person is being very aggressive. And so really thinking about, that's a traumatic reaction. They've had negative experiences. This is not personal to me. There are things that I can say to really bring down, de-escalate the situation, but then also set my boundaries and while conveying messages of compassion. Here are several escalation approaches. Again, I have the rationale behind having all of these here was you're going to be able to take these with you. It's a lot, and I think over time, the more you do this, the easier it is to weave all of them in here. So I like to focus on a few at a time, and as I mentioned before, thinking about weaving them in little by little in your own trainings. I like to incorporate these into like what I call my toolbox, and a few of them just become automatic, and you slowly improve your own practice, including others. So speaking in a calm voice, invisible hands, that's easy for me. I gesticulate a lot, but there's something about being able to show that you're not hiding anything, that is very helpful. It's also important, like when you're talking with someone that is agitated or in altered state, not to touch them. That was very hard for me, because whenever I feel like I need to share with someone or just help them calm down, I like to either put my hand on their shoulder or just and you shouldn't do that. Actually, there are a lot of people who find any touch very reactive, and it's not good. And so acknowledge what the patient is saying, acknowledge while setting your boundaries, and try to the best to show empathy and being non-judgmental. Use their name, be okay with silence, and be respectful. Treat them with dignity, even if they don't say a word. Feel comfortable with that silence, and as long as you continue respecting their space, and it can really go a long way. Okay, so here's the list again of all of them. I think it's important for us to again become more used to being able to engage in this if someone is in a situation. Again, all of this is for people that are in non-therapeutic settings, and so it's hard to learn, but you can learn it, and it's something that over time we can become really good at this. I am going to send additional resources with each of these for all of you to have. But for now, what I wanted to see is if you can maybe talk a little bit about some of your experiences and what you have found useful. Like, for example, any specific situations that you've been in that you find it difficult, that or that you had a lot of success in, or situations you encountered with that, challenged your own biases or preconceptions that influenced your interactions with a person that was experiencing trauma. Like, how did you become aware of it? Like, I'm curious to see what you all think about this approach and what your experiences have been.